Hi, my name is Dr. Lucy Meyer from Third Coast Foot and Ankle, and let's talk about how to get rid of neuroma pain. So neuromas are a swelling of the nerve in the ball of our foot. So it oftentimes feels like a pebble or a rock, sometimes shooting pain kind of in that ball area into the toes. Neuromas are not significantly uncommon, but the need for surgery is quite uncommon for these pesky little guys. So let's talk about some of those strategies to get rid of the pain without surgery. Now, the first thing that we should do is really think about the shoes that we are wearing and sometimes adding some additional padding in the area to decrease some of that pain. There is a specific way to add that padding that is most effective. It's not just cushioning the area where you're having pain, but actually repositioning where your foot is putting that pressure away from the neuroma. Now, the best way to do this is with a custom orthotic, but there are also ways that we do this in the office to kind of test out how well your body will respond to this treatment. Another great way to decrease that pain is to try to decrease the inflammation. So a lot of the pain is really being driven by the inflammation in the site. There's a couple of ways to do that. So ibuprofen and Aleve is the great at-home option. You can also try icing the area. Though I'll be honest, ice can be tricky with nerves. Nerves don't always respond the best to ice. So if you're noticing ice not helping, that is okay. You do not have to keep doing it. If you're still having pain after ibuprofen or Aleve and it is not going away or possibly even getting worse, there are situations where we give cortisone injections to really check that nerve back into a normal level of discomfort. I do not consider cortisone injections ever the cure to any disease, but it can really help us get through a bad spell and kind of reassess the area and get some of these more conservative therapies to work better, like that padding or change in shoes. Now, there are other more advanced therapies that we'll use. One very common one is laser therapy. We use a level 4 cold laser in our office. And what we're doing is using lasers or light energy to essentially manipulate those cells in that area, including blocking pain receptors. So if you can have this immediate effect of not only treating the neuroma, but also treating that pain and getting your pain level to go down quickly without any major side effects. Something newer that is being utilized in this area is shockwave therapy, which is really looking at trying to allow for regeneration of that nerve. And then lastly, what we would turn to is surgery, but this is quite rare. As I said before, we typically do not have to use surgical procedures to get neuroma pain under control. So if you've been struggling from neuroma pain, please let us know and we will walk you through all of those options to get you feeling better. We offer all of these therapies right here in our office at Third Coast Foot and Ankle.